eyelid skin is the thinnest skin in the body, and this means that it's very susceptible to aging changes. As we get older, the skin loses elasticity, and this contributes to an excessive amount of skin on your upper eyelids. This typically causes heaviness on the upper eyelids, and in some cases can actually be enough to cause obstruction in vision. In addition to this, the upper eyelid fat pads can protrude as we get older, and this will lead to the formation of bulging or puffiness on the upper eyelids. And the commonest area for this is the inner aspect of the upper eyelids. Now, it's also really important when assessing the upper eyelids to consider the brow, which sits right next to the upper eyelids. And as we get older, gravity plays a part, and typically we see that the eyebrows descend with time, usually affecting the outer corner of the brow first. And when there is concurrent brow ptosis or brow droop, this can accentuate the effects of excessive upper eyelid skin. So it's very important to assess the eyebrows alongside the eyelids when planning an upper eyelid blepharoplasty procedure. Generally, individuals who are healthy and who are bothered by the heaviness or the appearance of the upper eyelids are good candidates for surgery. As smoking can impair the healing process after surgery, it's important that if a patient does smoke, that they stop in the preparation period and run up to surgery. Also, active medical conditions may require that blepharoplasty surgery be deferred to a better time point, and all of this will be discussed during a detailed consultation. So upper eyelid blepharoplasty is generally performed under local anaesthetic. It can be also performed with sedation or indeed general anaesthesia if that is what the patient's preference is and if they're suitable. The upper eyelid skin crease is used as the incision point for blepharoplasty surgery, and this means that the scar that you see following surgery is hidden in a natural crease line, and this gives rise to what is called as a scarless blepharoplasty, meaning that the scar is hidden in a pre-existing line, and through this incision excess skin is removed, and I often take a section of the orbicularis muscle if required. If there are protruding fat pads, these can be removed also. And then the incision is closed neatly with sutures running along the skin. The sutures are generally taken out 1 week following the procedure, and you can expect upper eyelid swelling and bruising, which typically lasts anywhere from a few days up to a week or two following the surgery. So following blepharoplasty surgery, it is a day case procedure, so you go home on the same day. Swelling and bruising is expected, and this is normal. Icing can really help to reduce the symptoms of swelling, so I always recommend this to my patients. Typically, most patients will return to normal activities within 7 to 10 days. The stitches will come out at usually, again, 7 days or so. Strenuous activity and swimming, I recommend to wait several weeks following surgery before resuming this. And as the swelling subsides, you'll really get a sense of the results that you can expect following the surgery. So upper eyelid blepharoplasty is a safe procedure when performed in skilled hands. But as with any surgical procedure, there are potential risks, and these include swelling, bruising, scarring, but as we mentioned, this is usually a hidden scar. Asymmetry can occasionally occur, and also those with pre-existing dry eyes can find that this is exacerbated in the period following surgery. During a consultation, we will discuss all the potential risks and side effects of this treatment, but I will always take steps to reduce and minimize any of these risks. Upper eyelid blepharoplasty can be transformative. Patients look and feel more refreshed, rejuvenated, and youthful. And in cases where the excess skin was causing an obstruction in vision, an improvement in visual function can be expected. If you are considering upper eyelid blepharoplasty surgery and would like to learn more, I encourage you to schedule a consultation with an experienced oculoplastic surgeon to discuss your requirements and understand your options.